have I ever thought about, have I ever attempted to get any type of mental health care, medications for myself and my anxiety? Yes. There's various background information that then will all come together. The last time I was in therapy was in college. It was to the point my problems were too much for the therapist there. So my weekly sessions were just me crying, having a safe place to cry. The last time I was on antidepressants was postpartum with my daughter. My midwife was able to prescribe legally the most amount of time she could, which was 30 days. And after that, I would need to go to my primary care, and my primary care physician was of the mind that once you lose the baby weight, you'll feel better. And that was the same story I got when I went with her with concerns of postpartum depression with my son. So, there's been struggles. 6 years ago with my midwife, postpartum, she arranged a meeting with a psychologist because she knew there was more, to everything going on in postpartum depression and postpartum anxiety. I was bringing stuff to the table before all that. And then after hours long conversation, assessment tests, she was like, the psychologist said, you have post-traumatic stress disorder and general anxiety disorder, and the postpartum depression and postpartum anxiety are just, the sprinkles on top of this cookie. And I mean, I didn't realize how far back everything stemmed, and I think everybody assumed everything started either when my kids were born or when I became a caregiver, but things were brewing before. And the psychologist said, can you just get prescribed some antidepressants, anti-anxiety medications, any combination of things? Sure. It will help with some surface level anxiety, but it's not going to help you with what is deeply rooted that needs working through. And she had recommended a combination of therapy with medication. Unfortunately, our insurance didn't cover this lovely individual, and I could not find any therapist in the area accepting new patients at that time. And this was before the popularity of telehealths and Zooms. It was all in-person doctors. So that was its own hurdle. And I fully agreed. I didn't want to just medicate without figuring out and managing and conquering and what was the cause and roots of things. So I really didn't just want to medicate. I wanted to get help otherwise. But I had a primary care physician who was saying, lose some weight, and unable to find therapists. So it just trickled away. Getting help, that is, not like my problems. The hunt for help trickled away. And this was months before needing to move back in to my folks when my dad was hospitalized. So focus shifted to him. No resentment. That's just the reality of things. Now let's fast forward to today. You can be thinking, why don't you just go get some help now? It's been years. So, sorry, Pretzel's with me, so she's shifting where the phone is. My current health insurance doesn't cover mental health care medications unless it's prescribed by a neurologist. And I don't know of any neurologist who will just see you as a patient to prescribe you an antidepressant or an anti-anxiety medication. To just walk in off the street and go, I have anxiety, prescribe me something. For example, my mom's neurologist handles her antidepressant prescription because her depression is in correlation to her multiple sclerosis. So he handles her mental health care needs with her multiple sclerosis. knock on wood, I don't have a neurological problem to justify seeing a neurologist to then help me with my mental health care needs. But, sorry, a primary care physician or a therapist, could they prescribe me something? Absolutely. But I'd have to pay out of pocket. It would not be covered. So there is a hurdle there. The next one is my copay for specialists, so a therapist of any kind, psychologist, psychiatrist, whatever, is $90. And that is hefty. And for example, while researching, when I was attempting to find a therapist within the last year and a half, and I found one who I liked, what I saw online, and their requirement was 2 sessions per week in the beginning while establishing a relationship. And then it would change, either decreasing or increasing at their discretion. So that would be $180 a week. I can't afford that. And then further researching other therapists in the area, be it telehealth or in person, many had session minimum requirements. And they weren't just one a week, one every other week, one a month. And I can't afford that. I simply don't have an extra at least $720 a month unaccounted for that I can throw at therapy sessions. I would get further anxiety thinking about the financial burden of me getting therapy. And that doesn't include if I were to find a neurologist to cover my mental health care medications. I would be paying them $90 to go in the office or to have a Zoom session, telehealth, whatever, for the medication. So it's not just $90 per session with the therapist, it's $90 per visit with the neurologist. Nope, I can't afford that. Now, my health insurance through them privately offer therapy like via telehealth on an app, and I think it said it was $35 a session, more manageable. In telehealth, great, I can make that work with my scheduling. And the problem is that is a personal preference to me. So you might sit there going, who cares, just do it. But this is a personal preference to me. You would put in like what your needs are, like if you know what your mental health needs are, you have previous diagnoses and whatnot, preferences of you want a male or female doctor, those types of things. You put that in. But you will potentially never have the same therapist every week, every 2 weeks, every month, whatever. You will have a therapist who fits your criteria, but not necessarily the same one every session. They will have access, of course, to your file and transcripts potentially of what was discussed and all that. But every time you hop on, it could potentially be somebody different. And I don't like that idea. I take a long time to trust. So the idea that every time I sign on, I'm going to see a different face there just doesn't make me feel comfortable. I can absolutely see how somebody can be fine with that. It's just not for me. I'm thankful that there is a service like this. I just wish my co-pays were cheaper in person and stuff. But, it's just not for me personally. So I am kind of left still with, I don't know what to do. Because I feel there are still more roadblocks. And with open enrollment approaching, who knows what insurance I'm going to land with if I get insurance. I don't know. I'm not quite sure how to get myself help right now with the parameters that are in place regarding my health insurance. So I have thought about it. I've attempted it. But as is the case with healthcare in America, especially mental health care, I've hit a lot of roadblocks that lead me to just give up. So that's the story. So if you're struggling and you haven't found a way to get help, you're not alone. Don't think you're giving in or, lazy or whatever. Sometimes it's just really hard. All right. Thanks for asking the question and bringing it up. Because I'm always happy to share realities of things to make people feel less alone or to bring awareness to something. And it allows me to vent. Okay. I hope y'all had a good week and that you have a good weekend. And I'll talk to you soon. Bye.